My name is Jessica Schmidt, and this is case study number 2. First, I wanted to go over the behavioral targets for my client, specifically behaviors for reduction. This client engages in task refusal, aggression, property destruction, and angry outbursts. Because I know that it is important to state intervention goals in observable and measurable terms, the BCBA has provided me with the operational definitions for these terms. For task refusal, it is defined as any occurrence in which client vocally or non-vocally refuses to begin a task within 15 seconds of the instruction, accompanied by yelling, crying, and or flopping to the floor. The hypothesized function, according to the FAST results, was escape and attention. The replacement behaviors that were implemented were self-monitoring and expressing emotions, as well as demanding for more time. The operational definition for aggression is defined as client making forceful contact between his hands and another person, forcefully grabbing or pinching and or throwing an object towards a person. The hypothesized function, according to the FAST, was also escape and attention. The replacement behaviors were self-monitoring and expressing emotions. For property destruction, it is defined as evidenced by client kicking, hitting, or throwing an item until it is broken. The hypothesized function, based off ABC data, was escape and access to an item or activity. The replacement behaviors were self-monitoring and expressing emotions. Lastly, angry outbursts was defined as client yelling, crying, flopping to the ground, and or leaving the work area. The hypothesized function, according to ABC data, was escape and then secondary gaining attention. The replacement behaviors implemented were self-monitoring and expressing emotions, as well as demanding for more time. I wanted to focus on task refusal, and the interventions that my BCBA chose to use for this was self-monitoring and expressing emotions, as well as demanding for more time. The objectives for self-monitoring and expressing emotions was that the client will be able to identify and express their emotions instead of engaging in challenging behavior in their natural environment. For manning for more time, the objective was that the client will be able to man for more time to complete a preferred activity when transitioning to a non-preferred activity without engaging in challenging behavior in their natural environment. I have had the opportunity to not only learn about these, but also implement them with this individual, and it has been really cool. Now I want to talk about whether those interventions were functionally relevant. First, it's important to note that the hypothesized functions for task refusal included escape and attention. For self-monitoring expressing emotions, I honestly wasn't sure if it was functionally related. My first thought was that it might be a prerequisite skill for manning for more time because they would be more self-aware of when they were getting to a point where they needed a break, or just to recognize that they didn't want to transition yet and they wanted more time. But then as I started to think more about it, I realized that maybe instead of getting attention by expressing emotions with problem behavior, they can gain attention more appropriately by expressing how they are feeling. And that would really target that same function of attention. You're just gaining it in a more appropriate way when you're expressing your emotions. For manning for more time, this one was a little bit more obvious to me because obviously in the past, they may have had a reinforcement history of getting more time when they were crying and yelling and flopping to the floor. But if we teach them to ask for more time, then that is a more appropriate way to still be able to escape, at least temporarily, from unwanted tasks. So I definitely think that that is functionally related when it comes to escape. Now let's talk about if the interventions were evidence-based. First, I want to discuss self-monitoring and expressing emotions because in reality, I wasn't really sure if that was evidence-based. I did some research of my own and the results were kind of cool. I know that for it to be evidence-based, it not only has to have evidence that it has positive outcomes, but it also needs to be somewhat related to your individual and their circumstances. For example, what are their demographics? What setting are they going to be learning this skill in? And so on. So, for the first study that I found, I saw that it decreased off task behaviors, increased skill acquisition, and was in a school setting. It's awesome that it decreased off task behaviors because that is what we're trying to target with this individual. So, that helped us know that it might be successful in that area with this individual. However, we are in an at-home setting rather than a school setting. The second article found that it increases on-task behaviors, and it was with elementary-aged participants. This was awesome because my kiddo is elementary aged, so that makes it possible that this intervention could be appropriate and successful with this kiddo because he fits that demographic. For the last article, it found that it increased on-task behaviors and participants were diagnosed with autism. My participant also has a diagnosis with autism, so that could help the cause for me to be a little bit more confident that it's going to be successful. Now let's dive into Manding for more time. The first article I found saw that it decreased problem behavior, increased communication, and participants were diagnosed with autism. This is awesome because I know that it is also important to recommend intervention goals and strategies based on factors such as client preferences, supporting environments, risks, constraints, and social validity. And part of that is what is important to the parents and the client. And one of their goals was to increase communication. And of course, decrease task refusal. So the fact that this showed positive results for decreasing problem behavior as well as increasing communication, and it was working with participants who had autism, then that can give me a little bit more confidence that it could be effective in those areas. The second one found that boys with autism, it was effective, as well as targeting problem behavior that was functionally maintained by attention and access, and it decreased problem behavior. This is awesome to know as well because this individual is male, and one of the functions of task refusal for this individual is thought to be attention. So this can be a good indication that it may help with that. The last article stated that it was with children with autism and increased communication and task completion. This is great for us because those both apply to my individual. Overall, I would say that both Manding for more time and expressing emotions and self-monitoring emotions were evidence-based practices in this case. Thank you.